Hi everybody, my name is Nancy. I'm the museum manager here at the Mutter Museum. Today we're taking the history of medicine out of the museum and into the bar to discuss how disease and medical treatments have influenced how we imbibe today. It's a historical happy hour, and today we're discussing antimalarials. Malaria is a deadly mosquito-borne infectious disease caused by a parasitic single-celled microorganism. When an infected mosquito bites a person, its saliva introduces the parasites into the person's blood. Parasites then travel to the liver where they mature and infect red blood cells. Malaria symptoms include fever, tiredness, vomiting, headaches, and in severe cases it can cause seizures, coma, and death. Malaria is most common in tropical and subtropical regions. Today, those of us from the Northern Hemisphere are most at risk while on vacation in a warmer climate. Despite effective antimalarials and treatments being available, in 2018 there were 228 million cases of malaria worldwide and 405,000 deaths. But in the 19th century, malaria was an even bigger problem. Quinine is a basic amine chemical, first isolated in 1820 from its main source, the bark of the cinchona tree. Bark extracts have been used to treat malaria since at least 1632. In the 1740s, Scottish doctor George Cleghorn discovered that quinine specifically could be used to treat and prevent the disease. Quinine doesn't taste very good. It is very bitter. The quinine tablets in this medicine kit are actually coated in chocolate. Talk about a spoonful of sugar. So, enter a modern cocktail staple, the gin and tonic. This cocktail was invented in the 1820s by soldiers of the British East India Company in India, thanks to that bitter antimalarial. These army folks were not on vacation. They were at war to extend British colonial control in India. They drank their quinine in tonic water, which has an unpleasant, bitter taste. Soldiers were already given a ration of gin, so they began to mix the two together, throw in a mixture of water, sugar, and lime, and voila, the gin and tonic was born. Since it is no longer used as an antimalarial, we have a selection of more effective agents available today, though the tablets are still notoriously large. Modern tonic water contains much less quinine and is usually sweetened and consequently much less bitter. Your modern nightcap no longer has enough quinine to prevent malaria, but it might still help you out with the occasional Charlie horse muscle cramp. Though ask your doctor about tonic water if your calves also spasm in the night. The medicinal use of wormwood, or Artemisia absinthium, which is the central ingredient and flavor in absinthe, dates all the way back to ancient Egypt and Greece. An herb, wormwood leaves and oil were used internally to treat digestion issues, parasites, and cancers, and externally for osteoarthritis due to the naturally occurring chemical components present, most notably thujone. Thujone is a toxic monoterpene compound which excites the central nervous system. It can be a stimulant in small quantities but cause seizures and death in large quantities. Today, wormwood is primarily a homeopathic or traditional option used in small quantities with low amounts of thujone present. Historically, absinthe first became popular in the 1840s after it was prescribed to French troops fighting the Ottoman Empire for conquest of Algeria, once again to prevent malaria. The thujone would somewhat effectively kill the small mosquito-borne parasites before the large people, and the troops brought their recreational taste for it back to France. The first evidence of absinthe as both a beverage and a remedy dates to the 18th century. According to one version of events, French doctor Pierre Ordinaire invented it as a cure-all medicine shortly after the French Revolution. He traveled around Couvet, Switzerland, selling it as a treatment for epilepsy, gout, kidney stones, and other conditions. By 1792, the Henriade sisters, who lived in Couvet, had obtained Ordinaire's recipe and began selling it as a medicinal elixir. However, it's also possible that the Henriade sisters were making that elixir before Ordinaire's arrival. Either way, the Henriade sisters sold their formula to a Major Dubide in 1797, who then opened the first known absinthe distillery. His brand eventually became known as Pernod Fils and remained one of the most popular brands of absinthe all the way up to 1914, when the drink was finally banned in France. Absinthe had a particularly bad reputation among alcohols due to that thujone, which would in large quantities occasionally cause hallucinations, along with other neurological effects. These visions gave the absinthe the nickname the Green Fairy. Between the banning of absinthe and the development of better antimalarials, absinthe is no longer considered a medicine, though certain grandmas might still suggest the licorice-y beverage for a stomachache. So, two of our favorite adult beverages owe their popularity to a parasitic single-celled microorganism. Who would have thought? Today, those of us over the age of 21 are hopefully lucky to imbibe for pleasure, not necessity. For more information on infectious diseases then and now, visit us in person or online at the Mutter Museum. Stay tuned for more videos about the medicinal origins of some of your barroom favorites. Like, comment, and subscribe, and until next time, stay safe and disturbingly informed.